New York City will involuntarily hospitalize more mentally ill people under new plan. These New Yorkers and hundreds of others like them are in urgent need of treatment yet often refuse it when offered. Mayor Eric Adams said, "The very nature of their illness keeps them from realizing they need intervention and support." In a move he said is aimed at tackling the city's mental health crisis, New York Mayor Eric Adams announced a directive Tuesday instructing police and first responders to remove people displaying severe symptoms of mental illness from the city subways and streets and take them, even involuntarily, to area hospitals. The directive, his office said, is in response to an ongoing crisis of individuals experiencing severe mental illnesses left untreated and unsheltered in New York City streets and subways. These New Yorkers and hundreds of others like them are in urgent need of treatment, yet often refuse it when offered, Adams said at a news conference. The very nature of their illnesses keeps them from realizing they need intervention and support. Without that intervention, they remain lost and isolated from society, tormented by delusions and disordered thinking. They cycle in and out of hospitals and jails. The directive would give the city's mobile crisis teams, police, firefighters, and other emergency response personnel a step-by-step process to evaluate and take people showing mental health symptoms to area hospitals for evaluation. Adams said the workers will receive enhanced training on how to assist those in mental health crisis, to make the determinations and compassionately care for those in crisis. First responders will work with clinical co-response teams deployed in the subways to aid in a coordinated mental health response, Adams said Tuesday. The move was criticized by some mental health professionals who said the city should focus on long-term solutions and avoid treating people who refuse. My most striking concern is this plan relies too much on coercion and the involuntary use of hospitals, and adding coercion to a failed system that is inadequate to begin with doesn't really address the fundamental issues of engagement and access to quality care, said Harvey Rosenthal, the CEO of the New York Association of Paediatric Rehabilitation Services. New York Civil Liberties Union Executive Director Donna Lieberman also condemned the plan. The mayor is playing fast and loose with the legal rights of New Yorkers and is not dedicating the resources necessary to address the mental health crisis that affects our communities, Lieberman said in a statement. The federal and state constitutions impose strict limits on the government's ability to detain people experiencing mental illness, limits that the mayor's proposed expansion is likely to violate. Forcing people into treatments is a failed strategy for connecting people to long-term treatment and care. Adams said there is a myth that involuntary assistance applies only in case of imminent harm, and he said the city will not abandon efforts for hospitalizations even if it's against a person's will. He invoked the full power of Kendra's law legislation that allows court-ordered assisted outpatient treatment. The law is named for Kendra Webdale, who died after she was pushed onto the subway tracks by a man with a history of mental illness. The city conceded that the legal landscape for such authority may be murky, saying in the directive that a case law does not provide extensive guidance regarding removals from mental health evaluations based on short interactions in the field. But it did suggest several situations in which the need for involuntary hospitalization could be reasonable, including serious untreated physical injury, unawareness, or delusional misapprehension of surroundings, or unawareness or delusional misapprehension of physical condition or health. The plan is part of a larger 11-point legislative agenda Adams hopes to push through the state legislature. Some of the points include updating the state's legal standard for involuntary hospitalization, which Adams says is too narrow, mandating coordination between inpatient and outpatient providers of mental health after someone is released from court-ordered inpatient mental health treatment, and requiring hospitals to share treatment records with city health officials conducting court-ordered outpatient care investigations, but only after patients have been afforded reasonable opportunities to challenge the disclosures in court. New York City continues to contend with crime on public transit. Several people were stabbed in the subways this year, and Michelle Go, 40, died after she was shoved in front of a subway car. The incidents led Adams and New York Governor Kathy Hochul in February to announce a safety plan to address public safety concerns and support people experiencing homelessness and serious mental illness on the city's subways. It also intended to crack down on people sleeping on the train platforms, exhibiting aggressive behavior to passengers, or creating an unsanitary environment in the subway system. Rosenthal said that while Adams does hint at some good policies, his overall approach misses the mark because it prioritizes hospital stays, a short-term solution, over investment in long-term solutions. We're not going to hospital our way out of this problem. We're not going to Kendra Law our way out of this problem, he said.